Yeah. Good evening, everyone. This is Pragna back again with a new topic. So today, in this video, I'm going to explain about the defects of vision. So we find nowadays many wearing spectacles of concave, convex, or maybe other types of lenses. So why do they wear that? What kind of defects are they having? So let us discuss today as to what are the most common defects that people find in vision. Let us start the video with discussing the different defects of vision. The first one is myopia, which is a very common defect that everyone nowadays finds. The next one is hyperopia or hypermetropia. And the third one is presbyopia. Let's start. The first one is myopia or nearsightedness. So what do you mean by myopia, or what is this kind of defect? And yeah, let us see. So a person with myopia can see nearby objects clearly but cannot see the far objects distinctly. So what do you mean by this? This is because their far point, you know what is the far point and near point for our eye? The near point is 25 centimeters and the far point is infinity. So a person with myopia has far point which is less than infinity. It is for that reason that they have a defect called myopia. So a person with myopia cannot see the far objects clearly but can see the nearby objects very clearly. This is because the far point for them is less than infinity. And why is this actually taking place? And where is the image being formed such that they will find a blurry image over there? This is because normally for a normal eye, the image would be formed exactly on the retina. But for a person having myopic eye, the image would be formed in front of retina rather than on it. It is for that reason that the image appears to be blurry. So what are the causes of myopia? So these are very important and you have to remember these two causes for sure. This will be asked for questions also. The first cause is that excessive curvature of the eye lens. Maybe because the eye lens has been excessively curved, for which they face myopia. Or the second one is that elongation of the eyeball. Say for example, you have a normal eye which is on the normal side, so the image would be formed exactly on the retina. But say the eyeball is elongated to a great extent that it would be formed in front of the retina. Because the eyeball is elongated a lot, the image would be formed in front of retina rather than on it. So these are the two causes. The first one is excessive curvature of the eyelids, and the second one is elongation of the eyeball. Correction of myopia by a concave lens of suitable power. Let us see, now we have a defect called myopia. Then how does this be corrected? What kind of lens is to be used? So for this, we need to use a concave lens. A concave lens. So what is the function of a concave lens over here? Concave lens will diverge the light rays. So when this image passes by the concave lens diverges in such a way that the image would be formed exactly on the retina. And that is why I mentioned this of suitable power. Based on the intensity of the defect we have, we use suitable power such that the image will be formed exactly on the retina. So this is about myopia. Now let us discuss about the other defect called hypermetropia or farsightedness. That is also called as farsightedness. So what is this? A person with hypermetropia can see far objects clearly but cannot see the nearby objects clearly. So this is quite opposite to myopia. So if you want to remember what is myopia, this becomes very easy for you. So a person with hypermetropia can see far away objects very clearly but not the near objects. This is because the near point, which is 25 centimeters for a normal eye, may be a little more for them. Maybe their near point is more than the normal near point for everyone. It is for that reason that they get this problem of hypermetropia. Now, where is the image being formed then? Now, in case of myopia, the image is formed in front of retina rather than on it. Now, where will the image be formed in case of hypermetropia? The image will be formed behind the retina. So then, you can know the cause. Let us discuss about that later. So, the image is formed behind the retina rather than on it. Now, what are the causes of hypermetropia? The first cause of hypermetropia is that the focal length of the eyelens is too small. So in the before case, the focal length is big, more, not big, more. But here, the focal length of the eyelens is too small, for which hypermetropia is being caused. The next one is that the eyeball has become too small. In the before case of myopia, the eyeball is too, elongated. It is for that reason that the image is formed in front of retina. But in this case, the eyeball is too small that the image is being formed behind the retina. So these are the two causes. The first cause is that the focal length of the eyelens is too small, and the next cause is that the eyeball has become too small. Correction. So actually there is an error over here. It is convex lens, but they have used concave word over here. So please ignore that. So now, correction of hypermetropia by convex lens of suitable power. Now, why are we using convex lens over here? So what is the work of convex lens? It converges the light rays. It converges the light rays so that the image will be formed exactly on the retina. So please ignore this diagram. And of suitable power. Hypermetropia will be corrected. The next one is presbyopia, which is again another defect that people basically are tend to have. So this defect is basically similar to hyperopia, but this takes place in old age people. So now, with the increase in age, basically the ciliary muscles don't work properly, and the flexibility of the eyelids also get reduced with the increase in the age. So, with the increase in the age, they find it difficult to see the nearby objects clearly and comfortably without corrective eyeglasses. So, this is called presbyopia. Presbyopia basically occurs in old age people where, because of the gradual weakening of the ciliary muscles which control the pupil and diminishing flexibility of the eyelids. So, these are two reasons for which presbyopia is caused. And again, presbyopia, they cannot see the nearby objects clearly. Now, so this is the diagram that I have chosen, and this is actually not given in your Ncert, but just as an extra information, I have chosen this diagram. So now, presbyopia, this is how it can be corrected by using corrective eyeglasses. And then, this is an extra information that I want to give you. It is actually there in your Ncert, but not detailedly explained. So this is something about cataract surgery. So sometimes the crystalline lens of people at old age becomes milky and cloudy. So why does this crystalline lens become milky and cloudy? So even our eyes have cells and even they would die. So when the dead cells get accumulated, near the lens, it becomes milky and cloudy because of the accumulation of all the dead cells present. So since it becomes milky and cloudy, this leads to partial